So I've been contemplating about the relevance of this video for a while now, and honestly, if it makes someone less anxious, then it was worth it. So I am Nora, and you're welcome to Cultured Health, the channel where I talk about public health issues that I find interesting. And the treatment plan I'm about to share was given to me by my teacher who volunteered to go to Wuhan, which is the epicenter of the viral outbreak. The disclaimer I want to give is that depending on the severity of the patient's symptoms and whether or not they had underlying medical conditions prior to the infection, as well as their general immune system and such, as treatment was very different. And so I hope that you don't take this as verbatim as the only solution or the only way to manage patients. It's just a plan that worked in general. Now, the treatment plan can be divided into 6 main parts. The first is oxygen therapy, fluid management, glucocorticoid use when necessary, antibiotic use when necessary, traditional Chinese medicine, and nutrition. Now, oxygen therapy involves giving the patient oxygen but in various forms. So it could be a nasal cannula, a tracheal intubation, it could be a CPAP or something of that sort, depending on the severity of the patient's condition and whether they were able to maintain the oxygen saturation in their system. So oxygen saturation is how we know how efficient the oxygen you are using or breathing in is staying in your body. Basically, if the patient did not have an underlying medical condition or they were not having severe symptoms, the main target was at a 93%. For fluid management, there was a restriction. The restriction on the amount of fluid the patients were able to ingest, because COVID-19 causes the lungs to produce a lot of exudates, a lot of fluid, a lot of mucus and stuff, and so there can be congestion that makes it much more difficult to breathe. And so if you are ingesting more fluid in your body, it's more likely that your body is not able to excrete it as quickly as possible, and so you retain more fluid, and that increases the level of pulmonary edema. For glucocorticoids and antibiotics, these were very subjective, like I said, depending on what the patient had. Glucocorticoids were mainly reserved for severe cases, and also antibiotics were given to patients that had previously gotten bacterial infections, or just to prevent superimposing infection. And for TCM, traditional Chinese medicine, the main aim for them was anti-inflammatory medications. So, and then the last is with nutrition. So patients were on enteral nutrition, and mainly the focus of nutrition was on probiotics, increasing the levels of probiotics in the gut, because COVID-19 causes patients to have chronic diarrhea and abdominal discomfort and pain for some, and this reduces its nutrition. And if the patient does not have fever or doesn't have fever for at least 3 days, has no difficulty breathing, the patient doesn't test positive for the COVID-19 for at least twice, and if their CT scan shows reduced lung lesions and markings, then they would be allowed to go home and be discharged. So for hydroxychloroquine, that has been very popular and very worldwide recommended at this time. It wasn't really a huge part of the care at the time. Wasn't really a huge part. It was, and so it's very subjective at the end of the day. All right. So I hope that this video encourages you that there is at least an idea of what works and what doesn't work, and hopefully this outbreak will stop, the vaccine will be created soon enough, and we'll be able to not depend on just supportive care, but be able to figure out how we can live and be alive. All right, thank you for watching. I'll see you next time. Bye.